My name's Erica Shepard. I am the Vice President of Patient Success at MyEyes, and we rent and sell home tonometers, which many of you are our patients. So it's great to see you. It's always nice to put faces with names, people we've talked to. And this is managing eye pressure and stress and proactive glaucoma care. And we are thrilled to have Dr. Brian Eng here. He's a glaucoma specialist and cataract surgeon. He's also the author of Proactive Glaucoma Care and co-founder of NutriVision. So he's got a great presentation. You know, we talk to glaucoma patients all the time, and what he's going to go over are things that you ask about all the time. So it's really exciting. So I just wanted to say a little bit about MyEyes before Dr. Eng gets started. And we have served now over 2.2 thousand patients with either a rental purchase of a home tonometer. 97% of our patients can successfully use a home tonometer. Sometimes that's what people see. They may think it's a hurdle, but it's actually very simple to use, and we walk you through the entire process. We have a customer satisfaction score of 95 and a net promoter score of 95. So our service, and we're a team of glaucoma patients. So we love talking to anybody using a home tonometer and wants to use a home tonometer. So those of you who haven't ever reached out to MyEyes, I encourage you to do so. And if you have questions, you can give us a call. And so the way this works for anybody who rents or purchases a home tonometer, super simple. The doctor submits a prescription. You place the order. The patient receives the device. We go through everything. Our patient ambassadors will get you up and running, get you taking measurements, support you through the whole experience. Then the patient returns the device back to MyEyes. We transmit the data, we download the data, and we send that data to you and your doctor. It's a rental. If it's a purchase, we still offer to send the data to your doctor if you need us to. A lot of people just do that themselves. And then between you and your provider, you adjust your care plan and your treatment plan based on the results. It's just a great way to measure IOP over a week or more and really see how it's fluctuating, if it's spiking, fluctuating, that kind of thing. At our pricing table, we have a diagnose plan, which is a weekly rental. And then we have a compare plan now that's new for us, where it's 2 non-consecutive weeks of a rental. So if you're getting treatment, you're getting laser, you're getting even drop changes, that type of thing, you can measure before and after, or 2 times after some kind of treatment. So that's a really exciting one. It's been very popular, and that was the demand of our doctors and patients to have a 2-week rental at a discounted cost. And then, of course, you can own a machine. And that's on there as well. And many of you, I know, do own your machine. And we do offer assistance for insurance reimbursement. So those of you who've wondered if insurance pays for it, not all insurances pay for it. Medicare definitely does not pay for it. But if you have a Medicare Advantage plan or some secondary plan, a lot of patients, we're seeing more and more getting reimbursed. We don't do the billing ourselves, but we'll give you everything you need to submit a claim. And it's kind of a grassroots effort to get this covered by insurance. So we're real champions of that and trying to help our patients. So with that, I'm going to turn it over to you, Dr. Eng, and you could start your presentation.
Thank you, Erica. Thanks for the introduction. And good evening, everyone. I'm really excited to be here today, because this is my first time presenting to an American audience. Now, because I live in Melbourne, I got a young family. I don't get to travel internationally a lot. But when I do get to go to the States to attend or present at conferences, one thing that really strikes me about the States is the cinema. You guys have this, it's just amazing that it seems to find its way into everything. The hotel breakfasts, muffins, oatmeal, even the coffee. It's like your national spice. If it hasn't got cinnamon in it, you find a way of sprinkling some cinnamon on top. So welcome to this lecture. It's about why glaucoma isn't only about eye pressure, because it's also about stress on your vision system. Now, I have a few disclaimers to make before we start. So what I'm going to share is my personal approach to holistic glaucoma care. This is not treatment recommendation. It is not expert consensus opinion. It is not randomized clinical trial evidence. And it certainly does not replace your regular prescribed treatments. It does not replace your regular monitoring protocol or schedule. We should include measuring your eye pressure at home. Now, with that out of the way, let's start. So if you are watching this webinar, I'm going to say that you will know of someone who has glaucoma. And you will also most likely know that high eye pressure is the main cause or the main risk factor for glaucoma. But did you know that glaucoma can occur even when eye pressure is normal? Research shows that around 30 to 40% of open-angle glaucoma patients have normal eye pressure. And in certain Asian populations, in certain Asian ethnicities, this increases to an astonishing 92%. So can you imagine this scenario? You're using your eye drops as instructed. You're putting them in every day, religiously. You're keeping your eye pressure under control. Yet, you may potentially still be losing vision from glaucoma. This is highly personal for me because this is exactly what happened to my father. Dad's 79 this year, and he's a retired family physician in Malaysia. He used to practice in a small town that's so small that I used to joke with my American and British friends. It's so small that there are no traffic lights, no roundabouts, and the only time you get a traffic jam was when cows were crossing the road. But of course, a lot has changed since then. Now we get traffic jams because Apple has just launched their new iPhone and everybody just queuing up to try and buy one. Anyway, back to Dad. So Dad's always had great vision. He's never needed to wear distance prescription glasses, never had any problems with his eyes. Pressure's always been normal until he lost half of his vision from glaucoma, despite having normal eye pressures. So that hit me really hard. So as a concerned son who happens to be a glaucoma specialist, I made sure he was put on the best eye drops. I made sure he followed the instructions of his eye specialist. I also flew him from Malaysia to Melbourne so that I could do SLT laser on him. But despite controlling his eye pressures, despite being able to keep the pressure low, I still felt like there was still something very important that was lacking in his glaucoma care. So that's when I delved deep into the research of what else we could do for glaucoma beyond managing eye pressure. And from there, I realized that glaucoma isn't only about eye pressure, it's actually about the health of the optic nerve. The optic nerve is the structure that connects your eye to the brain in real time. You can think of it as the light-speed HDMI cable that connects the ultra-high-definition camera, which is your eye, to your brain, which is the super processor computer. So in order to see, you need all three components to work well, in particular, the optic nerve. The thing about the optic nerve is that because of the role that it plays, there are a lot of metabolic demands, very high metabolic demands that are being placed on it. And it's because of this that the optic nerves are very vulnerable, highly susceptible to damage. not only from eye pressure, but also from daily stress and physical aging. And that's why you can still get glaucoma damage even when your eye pressure is normal. So it's very important that we try to strengthen the optic nerves, we try to reduce its vulnerability and increase its resilience against pressure. But what if I told you that there might be habits that you do every day on a daily basis that could potentially harm your optic nerve without you even realizing it? I call these blind spot habits. And today I'm going to share 5 blind spot habits today. The first blind spot habit is spending too much time in front of screens. Now, a lot of people are worried and concerned about screen time overexposure, and rightly so. But that's usually in the context of potential damage to your retina, or digital eye strain, or myopia in children. And at this point, I just want to categorically say that there's no direct link between screen time and eye pressure or screen time with glaucoma. Okay? But if you're spending too much time in front of screens, it also means that you are not spending enough time exercising or engaging in physical activity. And let's be honest here. It's very appealing that, when you come home after a long day, you kick off your shoes, whip out the snacks, sit in your comfy sofa, turn on the telly, and watch impressive physical specimens running around trying to score points using a ball of some sort, or simply even just trying to beat each other up. The point here is that when you are not exercising, then you are not supporting circulation to your vision system. You're not helping your optic nerve to keep up with its metabolic demands. And the research has shown that people who don't engage in regular physical activity or exercise, they're potentially at an increased risk of glaucoma by 2.4 times. So the solution to this would be to schedule regular daily exercise. And by that, I don't mean going to the gym and pumping iron for 2 hours every day. Even scheduling in moderate to brisk walking for 30 minutes a day, that's going to build up over the long run. And the research shows that people who do regular moderate to brisk aerobic exercise every day, they potentially have 58% less risk of glaucoma. And this is why physical activity or exercise is the first key pillar of proactive glaucoma care. The second blind spot is letting frustration build. And by that, not managing your stress, because glaucoma itself is highly stressful. But here's the kicker. Stress can make your glaucoma worse. Personally, I feel that stress is a very important risk factor for glaucoma, but it's highly under-recognized. Because when you are stressed, your circulating stress hormones build up. And one of them happens to be cortisol. And cortisol is a steroid. And we all know that steroids can elevate eye pressure. Last year, a paper found that people who get stressed, glaucoma, who have glaucoma, they potentially have IOP elevations by over 4 millimeters mercury. And that could be highly significant for some. And earlier this year, researchers also investigated the link between stress and glaucoma risk. And in a 10-point stress score, they found that for every increase in stress point, there was an associated increase in glaucoma risk by 11%. So this really shows the importance of stress in relation to glaucoma. Now, obviously, I can't ask you to live a life of no stress. I mean, come on, even the Dalai Lama gets stressed too. So the key here is to make sure you can manage your stress effectively. And best ways of managing stress is actually through mindfulness meditation and also deep breathing. In deep breathing, what you do is you take 5 seconds to inhale and 5 seconds to exhale. And you just do this for a couple of minutes, 3 times a day. And the research shows that doing this helps to reduce blood pressure, it helps to reduce the circulating stress hormones, it also helps to reduce eye pressure potentially by 12.5%. So personally, I feel that it helps me a lot, helps to calm me down, helps to relax me, especially when I'm stuck in traffic and I'm late for an important meeting, or I'm rushing to get to childcare to pick the kids up on time before they start charging me an arm and a leg for every single minute that I'm late. Stress management is really important, and that's why it takes its place as the second key pillar of proactive glaucoma care. So the next time you're faced with a situation that's really troubling, don't get stressed, get even. So the thing about stress, though, is it's not something that occurs in isolation. It can bleed into other aspects of your life. And I'm not going to ask for a show of hands, but how many of you know of someone who's staying up late because they brought work home? Or do you know someone who's staying up late because Netflix just dropped that next episode and you just have to watch that, drop the brand new series and you just have to watch that next episode? So whether it's from digital distractions or work stress or just poor sleep habits, staying up late has become the norm for many people. And the problem with that, of course, is that your eyes just don't get a break. Because when you're sleeping, you're not just resting, you're assisting in repair and recovery. When you sleep, your body is able to regulate cortisol, is able to restore blood flow, is able to eliminate any metabolic excess. So if you're skimping on sleep, then you're missing out on this nightly reset. And the research shows that people who sleep for 3 hours or less a night, they have increase in glaucoma-related view loss by 3 times. Interestingly, if you slept for more than 10 hours every night, that can also increase your risk of glaucoma view loss. So the sweet spot is to aim for around 7 to 8 hours of sleep every night. So the next time you're tempted to hit the play next episode button, or you want to hit the next pile of work, maybe your optic nerves might prefer if you hit the sack instead. And this makes sleep the third key pillar of proactive glaucoma care. The fourth blind spot is something that we're all very aware of, and it's become something of a modern day epidemic. And yes, I'm talking about sugar. Too much sugar in your diet can sabotage your eye health. And here's why. When you take lots of sugar, it can increase your systemic inflammation and increase insulin resistance. This has the effect of impairing blood flow and affecting cell metabolism. And it's not just candy or sweet treats or desserts. It's also about the hidden sugars that you get in ultra-processed foods, in sauces, in healthy snacks. Over time, these can really build up in your body. And when you have so much sugar in the diet, it creates a metabolic environment that is pretty hostile to your optic nerve. And this can potentially increase your glaucoma risk by 51%. So if you like to snack, why not snack on fruits or vegetables? Snack on an apple or carrot or celery stick. Now granted, a pale light green celery stick is nowhere near as appealing as a sweet and salted caramel macaron drizzled in premium coffee-infused chocolate sauce. The pinnacle of dessert luxury that is so ultra-processed that you just probably spike your blood sugar just by looking at it. The point I'm trying to make here is that people who have a diet, a healthy diet with lots of fruits and vegetables and real foods that your grandmother would recognize, things like eggs and fish, they potentially have 79% less risk of glaucoma compared to those who don't. And this is why nutrition is the fourth key pillar of proactive glaucoma care. It's about what you eat and what you don't eat that are equally important. And this leads nicely to the fifth blind spot. Again, I'm not going to ask for show of hands, but how many of you know of someone who's taking a vitamin or a supplement of some sort for their glaucoma? This is actually quite common, and this trend is only going to increase because more and more people are realizing the importance of looking after their eyes, just as they would their brain, their heart, their gut, their skin, their joints. And they turn to supplements to help fill in any gaps from the diet or from their usual care. But if you're going to take vitamins for your glaucoma, then you got to make sure that you're not taking the wrong vitamins and that you're not taking the wrong doses. A good example is vitamin B3. So vitamin B3 has really increased in popularity lately because of recent published research showing that it is able to increase optic nerve resilience against pressure. But not many people know that there are several forms of vitamin B3. Niacin is the most common form, but that's the form that most people take. It's actually the nicotinamide form that has been studied, that has been found to be beneficial for glaucoma. So that's the one you need to take because it's got better bioavailability to the optic nerve cells. The next question a lot of people ask me is, Brian, what are other vitamins and supplements that I should take for my glaucoma? So the answer to this is actually not that straightforward because you don't want to just recommend any multivitamin that's generic or just any fish oil. Because what you really want is to target the cellular and circulatory risks that contribute to glaucoma risk, that help to drive glaucoma damage. And so I spent over 2 years researching deeply into this and I developed the NT10 system. In this evidence-based framework, it identifies and addresses the 10 key biocellular risks and mechanisms that help drive glaucoma damage. But to make things simpler and easier to understand, I've grouped them into 4 core areas of optic nerve protection. The first core area is to reduce pressure of the eye and of the mind. And here's where saffron really excels. Saffron has been used in hundreds of years in traditional Persian and Ayurvedic medicine. And they use it for general well-being, for brain function, and for mental health. And recent studies have affirmed this. They have found that saffron can help to improve mood, reduce the impact of stress, induce calmness by up to 50%. But more importantly, a study has also found that saffron could potentially help to reduce eye pressure by 15.5% in those with stable open-angle glaucoma. The second core area is to support cellular function, particularly cell energy, cell repair, and antioxidant protection. Here, the nicotinamide form of vitamin D3 helps to recharge the batteries of the stressed optic nerve cells, helping to keep them alive and functioning even when under pressure. Vitamin D and folate are critical for cell repair, helping to support optic nerve recovery even when under stress. And finally, optic nerve protection against free radical damage. So you need antioxidant support And I'm not talking about generic antioxidants like vitamin C or vitamin E. I'm talking about more precise, high-impact antioxidants like that can work at a deeper cellular level, like proanthocyanins in grapeseed. The third core area is vascular or circulatory support. And in this regard, ginkgo biloba and bilberry really stand out. They have been shown to be able to increase blood flow to the vision system by 23%. And more importantly, there have been some studies suggesting that they could potentially help to reduce the rate of visual field loss in normal tension glaucoma patients. And the final core area is to support optic nerve function. And you can achieve this by supplementing with folate and vitamin B12. So back to the question of which vitamins and supplements to take for glaucoma, it really depends on which area that you want to support. If you're looking for pressure and stress support, then saffron would be an ideal option. Or if you want circulatory support, then ginkgo biloba and bilberry would be great supplements to take. But if you want everything support across all four core areas to cover all the 10 aspects in NP10, then you may consider taking the glaucoma vitamin stack. The fact is that neuroprotection at this level of depth and specificity, that's not really addressed in standard glaucoma care. But it could be quite important for some. And this is what I call the neuroprotection gap. And this is why the fifth key pillar of proactive glaucoma care is neuroprotection, to fill the neuroprotection gap. Back to my dad. So this is what I got him to do. So he goes to the gym quite regularly, but it was mainly sort of strength-based exercises to help maintain muscle mass. I wanted him to do more aerobic activity to help with circulation. So when I talked to him, I suggested to Dad that maybe you might consider taking the stairs more often rather than taking the elevator or the escalators all the time. And he agreed. So a few months later, I checked in on him and asked him, how's the walking and stair climbing going? And he was like, yeah, great. I'm taking the stairs every day when I go to the gym on level 5. And I thought that's amazing. But to put it in context, apartment complex that he lives in has got 27 or 29 levels. And he lives on the 27th floor. So every day he's taking 22 flights of stairs up and down to get to his gym. And I thought that was just amazing. And yeah, at this rate, he's going to be way, way, way fitter than I'm ever going to be. Then also does meditation every day. He's a practicing Buddhist. So I've encouraged him to keep going with this practice. He's also a firm believer in early to bed, early to rise. So he does get 7 to 8 hours of sleep every night. I'm so glad that I managed to put him off from getting that Netflix subscription. And for someone who lives in Malaysia, he actually has a pretty healthy diet. Actually, he started doing intermittent fasting a few years ago, and I think that's really helped him too. And of course, I got him to take the glaucoma vitamin stack because I wanted him to cover the neuroprotection gap in accordance to NP10. So essentially, I got my dad to practice all the 5 key pillars of proactive glaucoma care. So on top of using his prescribed treatments, he will focus on exercise, managing stress, sleep, eating healthy, and neuroprotection. So for him, it was a source of great reassurance that he done everything that he possibly can to help support his long-term vision on top of using his eye drops to control eye pressure. So at this point, I would like to emphasize disclaimer again. So what I shared today is my dad's personal journey with glaucoma, how he's adapting his lifestyle to help support his long-term vision on top of his prescribed treatments. This is not treatment recommendation. This is not randomized clinical trial evidence. And please, it certainly does not replace regular monitoring, including with home-tonometry, and does not replace your prescribed approved treatments. It's very important that you remember this. I thought I'd end this presentation with a fun fact. My kids, they love fun facts at the moment. Actually, they love twisting my brain with fun facts. So we all know that scorpions are usually black in color. That's the most common color, the most obvious color. But did you know that when you shine UV light on a scorpion, the black color turns bright blue-green? I didn't know this, and it wasn't obvious to me. And to be fair, it's not really something you'd notice unless you knew where to look. And the reason I'm telling you this is because glaucoma management is a little bit like that. Because we tend to focus so much on obvious, which is eye pressure, which is the black color part. But there are also deeper layers, hidden layers that could be important as well. Things like stress, circulation, and cellular resilience. That's the blue-green part. So if we want to achieve the best outcomes in our glaucoma care, if we want to reduce risk as much as possible, then we really have to consider combining black and the blue-green part. Because losing vision from glaucoma is way scarier than a glowing scorpion in the dark. And before we wrap up and go to Q&A, I'd like to introduce to you my ebook, Proactive Glaucoma Care. I know we've covered a lot of ground in the past 30 minutes. It's a lot to take in. Some of what I've talked about may seem unconventional and may not be what you're used to hearing from your eye specialist. And that's okay, because these approaches are not part of standard glaucoma care yet. And so I put together everything into this resource, the Proactive Glaucoma Care ebook. And if you found tonight's talk interesting and you want to learn more, you want to explore further, then you can order your e-copy by scanning the QR code that you see on the screen. It covers everything that is discussed today, including the NP10 system, and it also features practical tips to help to support your long-term vision and also questions that you can take to ask your eye specialist at your next visit. For each order, $5 will go directly to the Fred Hollows Foundation to help fund sight-saving operations for people who would otherwise go blind, like children and women who have to work to support and feed their families but can't because of poor vision. So when you place an order, you're not only investing in your own eye health, but you're also helping to restore someone else's sight. So it's a great way to keep the momentum going after tonight and also to make a huge difference in someone else's life. Right. So if your optic nerves are still firing after all this, take a breath, grab a drink, and I think we can go on to questions next. I'll hand over to Erica now.
Thank you, Dr. Ang. That was excellent information. And I just want to thank you also for sharing the story about your father. He sounds like an incredible person. And, everybody here on this meeting can relate for sure, whether it's themselves or whether it's their family member. So that's just great. Thank you so much. And we can go through some of the questions. So I'm just going to go through the ones in the chat here. And the first two kind of go together. How does sleep apnea affect glaucoma? And how beneficial is sleeping on a wedge?
Yeah, so sleep apnea is a key risk factor for glaucoma. If it's not treated, it could increase your glaucoma risk by 10 times. So if you've got sleep apnea, you gotta make sure that that's treated properly. With regards to sleeping on a wedge, the studies show that if you're lying supine, then that could elevate your eye pressure a bit when you sleep. Sleeping supine can help to reduce the eye pressure, can help with reducing that eye pressure elevation when you sleep. But for me, the most important thing should be you get deep sleep. So if you can sleep well on a wedge, then yes, please do it. But if you find that sleeping on the wedge is going to cause you neck problems or back problems, then that's okay. I would say prioritizing deep sleep is more important because you would already have your standard treatments to reduce eye pressure, which is your eye drops or your laser treatments or your operations. So for me, please prioritize good sleep. Will help with cell repair, slight reduction in pressure that you get from sleeping on a wedge. I'm not sure that would make a really big difference in the long run.
Great. Thank you. What is your recommended dose of vitamin B3?
Yeah, that's a good question. That's the studies actually looked at doses of like 2,000 to 3,000 milligrams. Okay. And to me, that's a lot. We are currently running a clinical trial here in Melbourne, looking at the long-term impact of vitamin B3 over 2 years. So that's still ongoing, and we should have more data hopefully in the next few years. But for now, personally, I feel that a dose of 500 milligrams daily should be okay to be taken over the long term because 2,000 to 3,000 milligrams a day, that's a mega dose. That's a huge dose to be taken over the long term. And the dose of 500 milligrams, you can get benefits on the skin. So I personally feel that 500 milligrams over the long term should ideally be sufficient for glaucoma.
Great. Thank you. The next one from Rosemary is, can you please address that nicotinamide can cause liver damage? Also, pyruvate is recommended and doesn't have this side effect.
I didn't catch that second part.
No, it says that pyruvate is recommended and doesn't have this.
Oh, yeah. So nicotinamide, yes, at doses of above 3,000 milligrams, it can potentially cause problems with liver. And I actually even had one patient who had some liver issues at a dose of 1,000 milligrams. And that's why I normally suggest a lower dose at 500 milligrams. With regards to pyruvate, yes, there was a study that showed a combination of pyruvate and vitamin B3, nicotinamide can help. I would say that a great natural source of pyruvate is actually apple skin. So maybe and it may not be so easy to get pyruvate at the doses that they evaluated in the trial, which is 2,000, 3,000 milligrams. So for my patients, I normally say, look, if you can, just eat more apples.
That's good advice. How does dry eye affect IOP?
I don't think that there's any direct impact of dry eye on IOP, but how dry eye can really affect that could be indirect. So if you're using eye drops and the eye drops are irritating the eye, especially if they have got benzalkonium preservatives, then that could irritate the eyes. And that might mean that you're more reluctant to put drops in. So I would say when you're using drops, where possible, try and get preservative-free eye drops, or if possible, maybe switch from eye drops to using SLT laser to control your eye pressure. Dry eye is so common in glaucoma patients. It's so common as we grow older. So if you're going to use drops to help to support and relieve your dry eyes, please make sure they're preservative-free eye drops.
Great advice. Our next question is from Carol. Have you heard of red light therapy for glaucoma? Any thoughts?
Yes, this is an area that I think is quite exciting. They have done some research on dry macular degeneration and has found some benefits. At the moment, I'm not aware of any clear clinical trials that have shown benefit of red light therapy for glaucoma. It doesn't mean no one's looking into this. They are. They just need to find out what the ideal wavelength is, the ideal treatment duration, energy levels. So there's a lot that needs to be evaluated before we can recommend it as specific treatment for glaucoma.
The next question is from Toby. Do any of the vitamins increase blood pressure?
You mean the ones that are listed or in general?
I believe that's probably what they're referring to. Yeah.
Yeah. So in fact, the ones that are listed probably help with reducing blood pressure. So for example, folate and vitamin B12, they can help to reduce homocysteine levels, and high homocysteine levels are risk factor for heart disease and high blood pressure and vascular events. So if anything, things like folate and B12 help to reduce blood pressure.
So the next was, is it possible to get the slides? Yes. We're going to actually send out the presentation. We'll send out the recording of the presentation, and we'll make sure that obviously the book QR code will be in there, but we'll make sure we put that in the email as well. So it's really handy for everybody to get to. Is there a link to the book? There must be a link as well, Dr. Eng.
I can email you the link afterwards.
Yeah, that'd be great, because I think some people might do better with the link. Judith, so has this regimen slowed down the progression of your dad's glaucoma and or vision loss?
Yes, has. So I'm very pleased to report that because of his determination and the hard work that he's put in, it's really helped to stabilize his condition. Again, please, this is case example only. It is not randomized clinical trial evidence. I'm just sharing my dad's journey. Okay. But yes, this really helped.
Yes, and we're happy about that. He seems like a great person. Can glaucoma be reversed?
It's a good question. And I would say it depends on the level of severity. Okay. So we would generally say that no, it cannot be reversed, because the optic nerve, with glaucoma, you get optic nerve damage. But the optic nerve isn't just one structure. It's got hundreds and thousands of smaller retinal ganglion cells. And these retinal ganglion cells are in varying states of health. You've got healthy cells, sick cells, and dead cells. So when we talk about glaucoma damage, we often refer to the dead cells. With dead cells, we can't do anything about them. We can't regenerate them, we can't regrow them, we can't clone them. But the sick cells, if we can feed them and nourish them and provide them with the correct supportive metabolic environment, then they could potentially improve their health. And as they improve their health, then you may regain back some lost function. So that is, again, personal opinion. It's not randomized clinical trial evidence and so on and so forth. But for me, I feel very strongly that we should help to support the sick cells, try to improve their health. So yes, glaucoma is irreversible, but it doesn't mean that we can't do anything for the sick and stressed cells.
And that's good news for all of us, right?
Yes.
Next is from Robert. And Dr. Eng, you're fielding all of these questions kind of from all different angles. So great job. Do you believe?
I hope I'm just doing justice.
You are definitely, no, it's great. You didn't know there's going to be a test after, right? Do you believe that electrical pulse stimulation treatments, as they're done in Europe, are effective at restoring a glaucoma patient's visual field?
So I've seen that, and I suspect that electrical pulse treatment works. Basically, sort of confirms what I said, that in some way, these electrical pulses just help to improve the health of the sick and stressed cells somehow, by helping these sick and stressed cells improve their health, it happened to also help with some of the visual function. But it's not likely to be able to reverse everything and restore all the vision that you have lost from glaucoma.
Bonnie, is there one combined pill that combines all of those vitamins?
Yes, but we will have to talk about that offline.
Okay. For pigment dispersion glaucoma, one of the most common recommendations is actually to avoid high impact aerobic exercise, like running, which is a standard way to exercise for many people and a way to deal with stress. Do you recommend that your patients avoid running?
Yeah, so I think if you can, because not everyone with pigment dispersion will get high eye pressure. Okay, so you probably need to test it out. So here's where my eyes would really be so full. So if you got pigment dispersion, go for a run and then check your eye pressure afterwards. And then you'll know whether your eye pressure is going to spike or not. And if your eye pressure spikes, then you've got your answer. If it doesn't, great, you can continue running. So talk to Erica.
Yeah, I can say that over the 3 years that I've had my home tonometer, it's not only saved my vision on multiple occasions, but it does allow you to see what, everybody's different. Everybody's, spikes and fluctuations are different and caused by different things. So it definitely allows you to catch those things and make sure you're either avoiding them or doing them.
Back to the question about sleep. Yeah, I think what you can do is lie down, check your pressure, and see how high the pressure goes up, and then do sleep or position yourself with a wedge and check your pressure. So that way you are acting based on facts and data that is personalized to you, not just what studies say. And that will give you the best indication of whether you should sleep with a wedge or not. Again, I still feel like for me, you should prioritize a good sleep. If it's just like 1 millimeter mercury increase when you lie and sleeping well, I accept that 1 millimeter increase in pressure.
Yeah. And the great thing about the home too also is that you can take measurements laying down or sitting up. So it's very versatile that way.
Hey, can I ask a question about sleep?
Fun.
I've been using the eye care, for 8 months or so, very thoroughly. And, I don't know if this is normal or not. What I've found is my eye pressure spikes, goes high during the middle of the night. So if you go into a eye doctor and you're pressured 9 in the morning, 10 in the morning, or during the day, the pressure is very normal. You'd think you had great pressure. It's just on where it should be. At night, it's consistent in both the eye with, glaucoma and my eye that doesn't yet have glaucoma. It goes up. And with my good eye, sometimes that even goes up to near, the 20 point, not all the time. It's down usually at the night from midnight to 6 in the morning. Is that common? I mean, so it's during the night that it goes up. So you would miss that if you didn't have a machine or you just relied on going into your eye doctor. You would miss the high points. And then on the other side, I find that my pressures go down when I'm exercising, when I'm working out. My pressures go down, in both eyes. And that's a little bit of a concern for me with my bad eye. My eye had glaucoma, and I did have the surgery where they cut the hole, in the eye. It's normally good and okay, even at night. I mean, it's below 10. It's 10. But if I go exercise, not even really hard exercises, but exercise standing up and weight machines and so forth, my pressure goes down, and there is a little bit of concern because sometimes it goes down into the 5 area. So I've got extremes when I'm sleeping, high, and when I'm exercising, it goes down low. Is that common or is that weird?
So the eye pressure does fluctuate throughout the day, and it's what we call the diurnal fluctuation. And it's actually more common for eye pressure to increase throughout the night than in the early morning. So I would suggest in your case, you should really note down these data points talk to your eye specialist when you
Yeah.
see him next. Because if you've got advanced glaucoma, your pressure is hitting 20 and maybe a target's like 12, that's clearly a major risk for you. And they might have to suggest more interventions for you. So that's the benefit of whole pressure monitoring.
Yeah, the average pressure is all within range, all very good. Even on my good eye. So it's just
So
periodically, but it's nights that it goes up. So
I'm going to chime in only because I'm passionate about this. So Brian, thank you so much. This has been phenomenal. So Vaughn, my name is Barbara Roscoe. I'm actually one of the co-founders of MyEyes because I've become passionate about learning about IOP, and I am a professor at Moran. We are working with Wilmer to understand exactly what you're asking. And we have found that, yes, the majority of patients do tend to spike in the early waking hours between 4 and 6. We now have over, data points on over close to 3,000 patients between Tom Johnson and myself and the Moran staff and Tom Johnson's at Wilmer. We are going to be starting to publish some of this because this is real-time learning. In terms of IOP going down after exercise, I actually do this routinely, not in pigmentary glaucoma patients, but in some of my other patients. I will have them exercise. And what happens, and Dr. Ang set us up beautifully for this, when you exercise, your nitric oxide levels go up, which actually lowers IOP. And if anybody on this call has heard about Vyzulta or uses Vyzulta actually has nitric oxide in it, which helps to lower IOP. So Vaughn, what you are noticing is actually a very understood physiologic response to exercise and nitric oxide. And if you think about it, that's why people that have cardiovascular disease, we tell them to exercise because it helps lower their blood pressure. It relaxes vascular tissue, and that's exactly what it's doing with your IOP. So with that, I will be quiet and go back on mute.
thank you very much.
Thank
I
you, Barbara.
would love to know more about your thoughts on that sometime.
Yeah. And I mean, I can say personally for me, I spike late at night and early in the morning. So, and again, when I rented the home tonometer, I was like in the 20s in the office and I was actually spiking into the 40s. So, you can just pick up things. You can't be in the office at 2:00 in the morning. So it's really, really helpful.
Well, I've got lots of data. I'm a maybe excessive in data. And I think my data was just presented at a eye conference by my physician because he was so impressed with having that much data. He says it reduced the time to correct my eyes by years. You wouldn't get that much data. They're shooting in the dark a lot of times because you only go in once every week or whatever. And my data had a big effect. It showed every eye drop I had, every kind of eye drop, how it impacted. It showed everything they did. There was an impact, and you could see it with data. So it's pretty amazing. I love it.
This is a way. Do we have the time? I will share something. I also ask some question.
Yeah, I had a question as well. I don't know if I
Do we have questions in chat?
Yeah. So very quick. I think I have a similar situation the gentleman just shared. The pressure will go up. But I found something interesting by talking to my doctor while I'm measuring using the equipment. he actually saw how I measure, because I don't know everybody. I always using my right hand to measure both eyes. I have a tendency, I have some eyes damaged already, not seeing very clear. I have a tendency, probably when my doctor told me, you are actually not measured the center, because every time I see him, my data is off from him.
Is
Then
this
he,
question in chat? Is this a chat question?
not Chad, sorry.
Oh, so we're just
Okay,
throwing out the questions out? I'm confused.
I'm just asking that question.
I know
I
this
asked the
question's in
doctor.
chat. Oh,
Okay, go ahead.
So what we can do is any question that's in chat, we can answer it. I know, Dr. Eng, how are you on time? Because we're over by a little bit.
Yeah, I'm okay to go for 5-10 minutes, but I was thinking maybe because my talk is more about lifestyle, we should probably stick to kind of lifestyle question. Then really, I'm sorry, your question is a little more technical. That might be something you would ask the MyEyes team later as a email.
Yes,
That's
that's
fine. Yeah.
a great question. Yeah, just reach out to us. There's a couple of questions here as I'm scrolling through the ones that are left here about alcohol and caffeine.
Yes. So alcohol may temporarily reduce eye pressure after you take it, but recent study found that over the long term, it actually elevates your eye pressure and increases glaucoma risk. Unfortunately, there's also no safe level. So even at intake levels below the recommended daily intake recommendations of UK and US are still increased glaucoma risk. Alcohol is not real good for your eye. And with coffee, they found that caffeine can elevate eye pressure. And so recommendation from one of the recent studies was to try and drink no more than 2 cups of coffee a day. If you even probably drinking tea would be a good alternative. Sorry, people hate me when I say that.
There's a question here about ginkgo biloba. Any thoughts on that?
Yeah, so ginkgo biloba is probably one of the most studied botanical extracts, particularly for normal tension glaucoma. It's mainly for its sort of antioxidant ability and also ability to support and promote circulation. It sort of gained quite a bit of interest for sort of visual field in normal tension glaucoma. The evidence for that is there's some evidence for it, but it's not like very strong. So I would say if you wanted to take it, you can. Please make sure you discuss this with your treating eye specialist first, because you've got other factors to consider as well.
Yes. Tracy asked about chocolate. I think you mentioned sugar at the beginning of your presentation.
Yeah, I think the cacao, it's got antioxidants, so it can be good in that regard. But the sugar, that's the part that's not so good. So you've got, I don't know, chocolate tastes good when there's no sugar in it, but yeah, try and limit that. I think it's the sugar part that's the part that's not so good for the eyes.
That's the best part of the chocolate.
I know.
All right. Well, I'll just say, like I said, there's other questions here in the chat. And we can get specific answers to those questions because we want to make sure that we address everything and address everybody's questions, because there's some great ones there. So, but I do want to thank you, Dr. Ang. You're very entertaining and just very passionate about what you're doing. And it's just such great information for those of us who suffer with this disease. And just thank you so much for being here.
Thank you. Thank you for inviting me, everyone. I hope you enjoyed it.
Thank you, everyone. And everybody have a lovely, and thank you for getting up early too, Dr. Ang. It's 6 o'clock in Melbourne. So yeah, thank you for joining us. We appreciate it.
Yes. Thank Thank you for having me.
Thank you.
And maybe next time we can talk again.
Great. Have a great night, everyone.
Bye, everyone.
Hi, could I just ask a question?